Hello, we're going to dive right in. Exercise prescription for pulmonary diseases, more specifically asthma and COPD, chronic obstructive pulmonary disease. In this presentation, we'll classify these two diseases, asthma and COPD. Uh, these diseases are significant causes of mortality and morbidity in individuals that have them. Individuals with these diseases are referred to pulmonary rehabilitation centers where exercise is usually the cornerstone treatment for them. Uh, Start off with asthma. Asthma is airway, or the definition of asthma is airway obstruction because of inflammation and bronchospasm that is mostly reversible. Um, it is characterized by episodes of bronchial hyperresponsiveness, airflow obstruction, and reoccurring wheezing, dys, dyspnea, dyspnea, yes, sorry, chest tightness, and coughing that occur particularly at night and early in the morning and are variable and often reversible. Usually, the asthma episodes are worsened with exercise, which is why individuals with the condition may stay away from physical activity or sports, uh, which then leads to a cause in a drop in the cardiorespiratory functioning of the individual. Uh, According to the ACSM, training may reduce the inflammation, severity of asthma, the numbers of days with the systems, the number of visits to the emergency room, system anxiety and depression, and should help them with their quality of life. Uh, Alrighty, on to exercise testing. The assessment of the physiological function should include cardiopulmonary capacity, pulmonary function, pre and post test, oxyhemoglobin saturation, all of these done non-invasively. Should be a VO2 max test, stress test is what they call it usually, spirometer to get this spirometry, yeah, the measure on the spirometer. Uh, and then the Borg scale, pain scale can be used. And then the most cheap and effective way that I've seen is the 6 minute walk test. Um, just put them on a treadmill, make them walk, or they can, if you have a flat surface, walk laps around exercise facility that is indoors, of course. That is the same level, and then you just test them, see how long they can walk. Um, so you do it on a treadmill, or you can probably do a cycle hygrometer, would be good too. For the appropriate standardized testing, you can use general age appropriate testing. The individual has a bronchial inhaler. They're able to use that before they do their exercise testing, so it kind of reflects everyday life, real life, what they do in their active daily living. Um, the assessment of the test should be high intensity, which is 80% of their heart max, or 40 to 60% of their measure estimated maximum voluntary ventilation, which lasts for the test should last 4 to 6 minutes, and then after the test, the spermometer should be used as a to test spermetry, yeah, can't say that, for 5, 10, 15, and 20 minutes following the exercise. But it is it's not appropriate to use the heart rate max or age predicted heart rate max, which is the 220 minus age, just because of the ventilatory limitations that the patients have. At no time should their oxyhemoglobin levels drop below 80. And that can be tested with a little non-invasive, I'm sure everybody's seen it that's been in a clinic, cardiopulmonary clinic. Looks like know what a thimble used to look like that sewers used to use, but it's kind of like a, open it up, looks like a stapler almost, put it over your finger, and it has sensors in it and picks up the oxyhemoglobin levels in there, and it should not ever read below 80 with patients like this. And then when they are doing their testing, 6-minute walk or whatever, get them on the Borg scale and just tell them from 1 to 10, and you don't need anything to go over a 6 or less than that. You know, between 4 and 6 is their pain threshold. All right, now for a prescription for aerobic exercise, there's going to be 2 different prescriptions. Going to be aerobic exercise and resistance exercise for both of these. So for frequency is going to be 2 to 3 days a week. The intensity is going to be at their approximate ventilatory aerobic threshold, or at least 60% of the VO2 max. And it should be determined in from the 6-minute walk test. You can do 80% of your 6-minute walk test. The time should last 20 to 30 minutes per day, and you can do that in increments of 4 to 5 minutes. But you want to progress up to that. The aerobic activity should include large muscle groups such as walking, running, or cycling. Swimming is preferable with asthma patients. The humidity helps. I think coming off the water helps with breathing. It's not dry, but the chlorine has some adverse effects on this condition. So chlorinated pool is preferred, and better tolerated for exercise. Progression for the first month might not see too much progression, but after that, you want to see you want to get them up to, going from, like I said, 60% of their VO2 max. After a month, you want to try to get them up to 70% VO2 max, and maybe an exercise session up to 40 minutes instead of 20 to 30. And maybe add their frequency, can go up to 5 days a week. Resistance exercise 2 or 3 days a week again. The intensity is going to be 60 to 70% for a newbie, 20 to 50% of their 1 rep max for the elderly, 2 to 4 sets of 8 to 12 reps for the general population. Rest 2 to 3 minutes in between, just like general population, and 48-hour rest for single muscle groups. Multi-joint, single joint exercises using free weights, machine weights, resistance bands. Just keep in mind not to create any imbalances, muscular imbalances, or imbalances for the people to cause fall hazards. Progression, just going to have a gradual progression, and then make sure that you're training your flexibility. For asthma, special considerations, these patients or individuals are experiencing exacerbations of their asthma should not exercise until the symptoms and airway function has improved and it's back to their normal. Uh, Make sure maybe you can use their, like I said earlier, their bronchial dilators if they have any of those, which they probably are prescribed those, uh, and this will help treat against their exercise-induced bronchial constriction if they have an episode or prevent them from having an episode during exercise. Try to individuals on a prolonged treatment with oral corticosteroids may experience peripheral muscle wasting and may benefit from this strength training. So the resistance training is really good. Say exercise in cold environments. That way, the allergy causing or the allergens and the pollutants that trigger the asthma effect will be less usually in the cold climates. Okay, now on the COPD. Background of COPD is it is defined as the global initiative, no, by the Global Initiative for Chronic Obstructive Lung Disease Program as a preventable and treatable disease with some significant extrapulmonary effects that are characterized by airflow limitations that is not fully reversible. The COPD consists of chronic bronchitis and emphysema, and the patients may be staged into one of four disease severity based on the results of the pulmonary test. The two main categories of pulmonary or the COPD is bronchitis and emphysema. Again, also be broken down in these other adverse pulmonary conditions: cystic fibrosis, bronchitis, pulmonary fibrosis, and lung cancer. The benefits through exercise with someone with COPD is mainly through the adaptations of musculoskeletal and cardiovascular systems, and in turn reduce the stress on the pulmonary system during exercise. All right, on to the exercise testing. Exercise testing. Modifications to the traditional protocol is warranted by their functional limitations early on the early onset of dyspnea during their GXT, or their 6-minute walk test. And that's with GXT. If you have someone walking at 60% and they're experiencing dyspnea between 5 to 9 minutes, probably have a pretty severe disease, and that's about as far as you want to push them the first time. So, but you get a good read on that. Make sure you're using their bronchodilator therapy, kind of the same thing as asthma. If they have it, that way the test is reflective of their everyday activity because they're using their bronchodilator all the time, or should be. But it should be noted that individuals with pulmonary disease may have ventilatory limitations to exercise, and so the VO2 max age predicted test here is also not appropriate. It's also going to go back just like asthma. 80% on the oxyhemoglobin saturation. You always want to use that. I would suggest using EKG. Anybody with this disease, EKG, oxyhemoglobin testing, and or the saturation or desaturation, and heart rate at all times, especially when you're first in the clinic. But just like any other exercise, they must be released by a doctor and be in close good communication with their doctor. All right, exercise prescription frequency 3 to 5 days a week for patients with COPD. 60 to 80% of their workload for vigorous, 30 to 40 with for light. Anything they do, they're going to see improvement. So the light intensity results in improvement in the symptoms. It's going to improve their quality of life and their performance in their everyday living activities. But also used Borg scale. Don't want to go higher than 6 with dips with pain and breathing. Their time for the vigorous exercise is just going to be just like general population. It's going to be a shorter time for more vigorous exercise, longer periods of time for their light intensities. But you go at least 20 to 30 minutes, and it can be 5-minute session, 3-minute sessions, however they can get it to get up there to begin with. But then you want to progress up to a single session. Aerobic activities, large muscle groups, just like asthma. Just using walking and cycling. And that'll be for their type. For the resistance training person or a client with COPD, it's going to be pretty much the same as general population, resistance and flexibility. So we're going to do 2 or 3 times a week. Reps up to 60 to 70% of their 1 rep max. 2 to 3 minutes between between sets. Multi-joint exercises, and then that's pretty good. For their special considerations for COPD, you could do some training of their, according to the ACSM, pulmonary diseases and their treatment not only affect the lung but the skeletal muscle around them as well. Resistance training of the skeletal muscle should be an integral part of the exercise prescription. For individuals with COPD, the exercise prescription for resistance training with pulmonary patients should follow the same as FIT principle for healthy adults and older adults, according to the ACSM. Because the individuals with COPD may experience greater dyspnea while performing daily living activities involving the upper extremities, it may be beneficial for these people to work these muscles of the shoulder girdle and perform these movements with resistance. Inspiratory muscle weakness is also a contributor to this disease, COPD. So in patients receiving optimal medical therapy who still present inspiratory muscle weakness and breathlessness, inspiratory muscle training is recommended. So the guideline for these is maybe to do 4 to 5 days a week, 30% of the maximum inspiratory pressure measured at the functional residual capacity, 30 minutes a day, or 2 15-minute sessions a day. 3 types of training of these is inspiratory resistive training, threshold loading, or Norma Kabnik hypernia. But between these three, there's no superior exercise been recorded. Always still keep in mind of the Borg scale, pain scale, in any of these exercises. The heart rate can't be the traditional age minus 220 heart rate can't be used on these just because of the special conditions. Bottom line with these is exercise is going to benefit any individual with asthma or COPD, but their exercise tolerance is not going to be the same as general population, so you're going to have to start out probably lower and slower than most of the time. And that asthma is the acute, usually reversible disease. COPD is your usually non-reversible airflow limitations disease. And main thing is these effects should be considered when you're exercising from the diseases. So thank you. I know it's long, 22 minutes. Alrighty, that's it. Thank you. Bye.